My name is Henry Ofori. I am an investigational drug services pharmacist, and I was part of the UNM class of 2018. So my pharmacy interest began in high school when chemistry was the first class I took where I felt that, wow, this is interesting because you have protons, electrons, neutrons, but you put them together in different ways and they make different things that feel different, they look different, they taste different. So that's what got me interested in pharmacy. I asked my high school teacher what I could do with chemistry, and he said, you can go into big pharma, you can work for a chemical company, or you can go into pharmacy. So after that, I started looking into the different things that I could do, and eventually I landed on pharmacy. For the pharmacy profession, I'm proud that we're pushing the envelope in terms of providing service for our patients. I think New Mexico and the UNM College of Pharmacy probably, I think, does one of the best jobs in doing so by providing services for rural areas and also pushing the envelope for pharmacists to be able to do many different things. I think graduating was probably my number one accomplishment. I think there were a lot of obstacles in my way before I was able to graduate. However, I was able to overcome those obstacles, and I was able to successfully graduate. So, I think my biggest professional struggle, and I think everyone goes through this, is imposter syndrome. So it's getting to the point where you feel confident enough that you are where you're supposed to be. I think especially a lot of times when you work with providers that have been working for 10, 20 years and you have to provide the expertise on the pharmacy side, sometimes you question yourself, and I think that's a struggle, but every day you can learn something new and get better. Some of the tools that I have used is reading more and always making sure that I'm prepared. So, making sure I'm ready for rounds, making sure if I have a meeting, I'm ready for the meeting by reading things that I need to read, and just overall making sure that every day I'm learning something new. My best piece of advice for anyone going into pharmacy is that pharmacy is difficult. Pharmacy school is difficult. However, you just have to have grit. You just have to keep pushing on. You have to keep moving through the classes and doing the best that you can. And sometimes you're not the best at something, but you can get better at it every day. I think don't put a lot of pressure on yourself as to what you want to do after pharmacy school. There are so many things that pharmacists can do, and take the opportunity to find that out while you're in school, while you're doing rotations, and ultimately just work hard and network, and the doors will open. I think therapies are changing a lot. Being an investigational drug services pharmacist, I'm in a position where I get to see the things that are coming out in the next 5 to 10 years. Therapies are moving more towards monoclonal antibodies and less towards, the, actual chemical structures for drugs. So I see things changing in the way we treat people, and I think it's very interesting what we have to look forward to. Yeah. So for an investigational drug services pharmacist, I think the best way to put it is that we operationalize research protocols. So the providers, when providers want to open a study, they are in communication with the drug sponsors, and pharmacy is a big part of that. So we need to be able to receive the drug, build the medication in the EMR system. We also need to educate pharmacists, nurses, and have patient consults as well, and make sure that the study goes as smoothly as possible. Make sure that we put any hard stops so that mistakes aren't made for the safety of the patient.